Hello, my name is Lauren. I'll be your nurse this evening. Can I have your name and your birth date? The patient will state their name and their birth date for me. And I will be performing a thorax and lung assessment on you today. So I'll start off with performing hand hygiene. The first thing I'll do is inspect the patient's skin. I'm checking for the color and condition. I'm palpating the skin to assess if there's any masses, lumps, any tenderness. The patient says there's no tenderness, so I'm going to move on. Assessing the tactile firmness. So first thing you do is you're going to put your hands on their chest and you're going to tell them to say 99, and you're going to go in a sequence down the chest and on the sides as they say 99, and you're assessing the vibrations and they should feel the same on each side. And you're going to do it on the back, same thing. You're going to assess for vibrations. You're going to have them say 99 all the way down. I'm going to say 99, check on the sides, and they're going to tell, or you're going to feel the same vibrations on each side. Okay, so now that we're facing their backside, we're going to assess again for the skin condition, the color, if there's any mass, lumps, or tenderness. I'm going to palpate the skin. I'm going to ask them if they have any pain. I see there's no mass or lumps or any lesions. So now I'm going to move on to the symmetric expansion on their back. So I'll place my hands on their lower back in the T9 and T10 region. I'm going to squeeze a little bit. I'm going to ask them to take a deep breath. What I should see is the thumbs expand, and it should be the same symmetry. Now I will begin with doing percussion. I'm going to start with the back side. I'm going to put my hand down onto the patient's back. I'm going to tap my middle finger. And I'm feeling for the vibration and the sound. Okay. Now I'm going to do it to the front side as well. Again, assessing the sound. Normal lung sound should be a resonant sound. Now I'm going to assess the patient's respirations for 30 seconds. Normal is between 12 and 20. After I do that, I'll move on to osculating his lung sounds. So we're checking to see if he has normal breath sounds or if he has abnormal or adventitious breath sounds. So I'm going to assess both sides and listen to his lungs, tell him to take a deep breath each time. Okay, we're going to assess on the sides. More. And assess on the sides again. Okay, now we're going to assess his back lung sounds. Okay. Telling him to take a deep breath each time. On the sides. Okay, now that we're done with the assessment portion of the examination, I'm going to give the patient some health promotion. What I would recommend to them is to avoid smoking cigarettes, and if they do smoke, I will give them resources and information on how to quit. I will thank the patient for allowing me to assess them. I'll ask if they have any further questions or if there's any information that they want to share with me at that time. After I'm completely done with the patient, I'll perform hand hygiene, and I'll leave the room and document my findings.